July here in New Zealand for Kiwis is often referred to as dry July, where some Kiwis who drink alcohol choose not to consume it. So I thought it was as good a time as any to talk about our alcohol consumption in New Zealand. Some research has recently been carried out of New Zealanders in midlife and their alcohol consumption. And joining me on the program today to talk about this, Professor Antonia Lyons from the Auckland University, who is also the chair of the Hugh Green Foundation and Addiction Research. Welcome to the program, Antonia.
Kia ora, Lizzie. Thank you very much for having me. It's nice to be here.
Yeah, so you guys recently carried out some research in midlife. What age range was that?
So we were looking at 40 to 65. So midlife adults, I mean, there are different definitions, but generally it's around between 40 to 65-year-olds. Yeah.
Sure. And is this kind of research being carried out on that cohort before?
Not really, because most of the research that's examined alcohol consumption is more being focused on young people.
Yeah.
And young people are the ones that we see more often in public drinking. And they do have the highest, young adults have the highest rates of hazardous drinking, but actually there are quite high rates of hazardous drinking in midlife and even older adults as well. It's just that we don't tend to see that. It's not very public.
We don't talk about it, right?
Drinking. Well, it's more happens in people's homes, and it's just, it's more hidden, I think.
Yeah. I mean, certainly from when I grew up, and I know this isn't part of your research particularly, but, you know, when I was a young teenager, a lot more teenagers were drinking and carrying on. Now I've got a teenage son and I'm related to other teens and kids in their early 20s, and a lot of them are less interested, which is nice to see with that sort of age group, I feel, as a parent.
Absolutely. And that's what the evidence shows us, is that there have been declines in youth drinking, and there's been a delay in starting to drink, which is great. You know, that's a real shift.
Something good's happening.
And if you think about the people who are at midlife, they grew up, they were teenagers at the time where the alcohol laws were were liberalised. So it was much easier to drink, and it became, the drinking age went down in 1999. So suddenly there were more opportunities to drink. It was possible to buy wine in supermarkets, and then subsequently it was possible to buy beer in supermarkets as well. And then there was a lot of marketing and work done to try and get that female market, and that's been happening over the last couple of decades to try and get women as, in their consuming as well. Even, men still consume more, but women also consume alcohol.
Sure. So in the participants that you surveyed, I think there was around 500.
Yeah.
Was it an equal mix of male and female?
We had mostly female, so we had 70% women who responded to the survey, 28% men, and then there are just over 1% who identified as another gender.
Sure.
And they were mainly Pākehā, so just over 81% were Pākehā, 9% were Māori, 1% Pacific, and 11% another ethnicity. So it was it wasn't a hugely heterogeneous sample, but we also did 37 interviews with a subset of those participants where we could explore things in more depth. So, sort of 60-minute interviews on Zoom mainly, where we talked about alcohol consumption.
So out of those people that you were interviewing, and maybe the ones over the Zoom, were participants concerned about the health risks associated with alcohol?
Well, they're quite knowledgeable, and it was a reasonably well-educated sample, and they were quite knowledgeable that alcohol has health harms, longer-term health harms, but it was only about 60% of them who knew that alcohol causes cancer. So we were kind of a little bit surprised by that, because I work in the field, so I thought that actually everybody knew that alcohol causes cancer, but not everybody does know that.
No, but I mean, a number of years ago, there was a real push about the connection with cancer and cigarettes, right? When I was sort of growing up, and suddenly all these horrible pictures would be all over the cigarette packets. I don't know if they are still, to discourage people from smoking. Yet I feel in this country, that alcohol has actually been kind of the opposite. Like, let's celebrate with alcohol, right?
Well, it's a really bizarre thing, because it's such a key part of so much of our lives, like it's embedded throughout so many aspects of our lives. And the meanings that people have around alcohol, and this is what's come out of our research, is that it is linked with celebrating, but also, when you're feeling stressed, it's linked with feeling stressed. It's linked with being busy. It's linked with parenting. It's linked with coping. I mean, we also know that alcohol has mental health effects. So the fact that the industry can market it in a way that it actually is, they market it so that, this is really good for if you're stressed. It's a really good way to relax. It's a really good way to unwind. You can use it for so many different things. It's a really good way to celebrate. Yeah. It's a really good way just to have a chill on a Friday night. So I think, the sorts of things that are done, like sponsoring breast cancer awareness or those kinds of things, or buying alcohol products that have the breast cancer awareness label on them, that doesn't make any sense.
No, it doesn't, does it? It's quite insidious. Really, I think another message that I feel, a lot of us would have heard, and this is one, that they often, that red wine is actually good for you, right? That's what I've heard.
The evidence shows that relationship doesn't exist.
Okay. So that was good marketing, right?
There was evidence that came out that showed there was a J-shaped curve, but they've since found, replicating these kinds of studies at large population levels, that when you look at other factors, that relationship doesn't hold true. So drinking in moderation doesn't have positive benefits for your health. And, different governments are looking at different recommended guidelines now around alcohol, and some of them are saying actually no alcohol is the best thing for your health. Any alcohol is harmful for your health. And that's what the Heart Foundation in New Zealand have also come out and said very recently. There's no level of alcohol consumption that's good for your health.
Wow. I had a friend, and many of us have friends like this, who had breast cancer. But this, in fact, I've had quite a few. But this particular friend, after having breast cancer, she gave out alcohol completely. Yet I have had other friends who have had cancer and haven't stopped drinking at all. There just doesn't seem to be a connection for a lot of us. I mean, like you say, you're in the field, but for us, it's like the message isn't getting through. What do you think would help?
Yeah, well, I think part of it, and this is another thing that came out, particularly from the interviews, is that alcohol is so normalized in a routine part of our lives. So we don't see it as a drug. Again, a couple of weeks ago, a study came out of New Zealand where they ranked all of the drugs, the sort of harms that were caused by different drugs, and alcohol came out as our number one most harmful drug.
Yeah, I saw that study.
And that's kind of not surprising, but we don't think about it in that way because it is so normalized. It is able to be purchased in the supermarkets. It is that kind of thing where it's linked into, I'll have a glass of wine or I'll have a beer while I'm cooking dinner. It's kind of embedded in there, partly through the marketing as this is my reward. This is an adult thing to do. Even new parents talk about, well, I feel like an adult again when, I have a drink. And that's really odd because you've become a parent. Isn't that the meanings around it?
Yeah.
Why is it that alcohol gives you the adulthood rather than the parenting gives you the adult?
That's good. That's real good. Yeah, you could apply that to young people, but I feel like they've kind of learnt that. I've graduated from school. I'm a young adult. I'm going to be responsible. Maybe I'll drink responsibly. Now, how about COVID impacting people's drinking habits? How did that sort of come up in your research?
60% said they'd changed their drinking habits, and 81% of those people said they'd increased their consumption. And partly when we did the interviews, that was because actually for a lot of people at midlife, they were working from home, they were homeschooling, they were juggling multiple responsibilities, and they said alcohol was the thing that they looked forward to at the end of the day. They found it really hard to unwind. But the alcohol was something that they could do at the end of the day to get them into that much more relaxed state. But it kind of wasn't just one drink for some people. It was like, you can stop work. It demarcated the end of the working day and the start of the home domestic stuff.
Yeah, I get you. How do we disrupt our drinking habits, Antonia?
That's a really good question. That's what we talk to our participants about as well. And it is about disrupting that everyday embeddedness. It's about making so it's not an ordinary commodity. So it's not everywhere. So it's not at the school picnics, for example. So it's not. So actually, people who say they choose not to drink, and people who have not decided not to drink for July might be able to recognise that now when they go out, there aren't that many alternative options, or you have to explain why you're not drinking, which is partly why Dry July is so great, because it's easy to say, I'm having a month off, I'm doing dry July. But it suddenly you start seeing how ubiquitous it is and how much it surrounds us, and it's in our environments. So I think it's disrupting that everydayness of it.
Yeah.
Marking it out as a drug, as a product that's harmful. I'm not saying at all that everybody should stop drinking. That's not my message.
Yeah.
My message is that people need to be informed and make those choices around alcohol with that information.
Professor Antonia Lyons, thank you so much for your time today.
Thank you very much.